So Kenna, I can tell you something brief about her, and then she can tell us more. Kenna started her healthcare career as a critical care nurse at Freighter in the neuro ICU, where she worked for 11 years. In 2013, she started as an organ donation specialist with Versiti. At the time, it was the Wisconsin Donor Network. After 4 years, in 2017, she was promoted to an organ donation specialist educator. And in her current role, she spends her time either on call out in the field or facilitating orientation and ongoing education for the organ donation specialist team. So with that, I'll let Kenna do a little bit of education and a little bit of talking about any questions, and answering any questions that you might have. Feel free to put whatever questions you have in the chat box and we can answer them when she's done. So thank you, Kenna.
Hi.
You can take it away.
Hi, thank you. Thank you so much for having me. I'm so excited to be here. I have an immense passion for donation. I've been working in my role for 8 years now, and obviously I love my job. I love what I do, but I really enjoy these kinds of events, going out and talking, educating nurses and doctors and students and anybody that will listen and hear me out about donation and all the good that can come from it. So thanks for having me. So just a little bit about me. She kind of started it out, but yes, I started my job as a nurse in 2005. I graduated, and shortly after that I took a position at Freighter in the neuro ICU. So I took care of a lot of patients, mostly with head traumas, brain injuries, seizures, strokes, aneurysms, brain tumors. So as that role as the nurse, you kind of recognize when a patient maybe is not doing so well, and you put that initial referral into the Wisconsin Donor Network. So I always found it fascinating when the coordinators would come on site and they would, get report from us, and they would, do what they were doing. I just thought it was so intriguing. And so then in 2013, I accepted a part-time position. So I had a little overlap there where I was working in the ICU and doing this job for a bit. And then quickly was like, okay, I want to do this full-time. So became a full-time coordinator. So with Versiti, just a little bit about Versiti and what it is. Versiti is an OPO, or an organ procurement organization. So there is we are one of 58 OPOs in the United States. So there's 2 in the state of Wisconsin, one based out of Milwaukee here, and then the other one in Madison. Our OPO services 52 hospitals in southeastern Wisconsin. So I can get a page in the morning and I could end up at Door County, I could end up in Kenosha. I mean, truly, wherever there is a person who could potentially become a donor, get in your car and you start heading that way. Our team is really, really small. It's actually grown quite a bit since I started. I think when I started, we had like 6 or 7 coordinators, but we now just hired another 2. So we're going to have 14 organ donation specialists on the team. We do have 4 FSS, which is our family service coordinators. As we continue to grow, just adding more people to our team to kind of help get all the pieces done has really been helpful. So the family service coordinators are the ones focusing on actually approaching and talking with the families, but the organ donation specialists are trained as well, and that is a big piece of what I have done in the past. We also have 5 AOCs. There are like an administrator on call for the day, so we turn to them for a lot of decision making and just a lot of questions and help. And we also have our medical director that we work with. So we're a really, really tight team, an amazing crew of people. We have our organ donation specialists or recovery specialists that are in the operating room with us, and then our hospital relations liaison staff that help us in the hospitals get everything that we need. So we have a great team of people. Just a little bit about us. We approached 219 families last year, and we had 116 organ donors. So it's a lot of work for us to do, and such a special mission that we are, dedicated to, all of us. So in the United States, there's 107,000 people on the waiting list right now. and 17 people pass away each day waiting for their gift of life. And the biggest piece of that is that to be a donor, it's so insanely rare. It's less than 1% of the population will pass in a way that allows for organ donation to happen. So, I mean, if you get in a car accident and you pass, out in the field, unfortunately, you're not able to be a donor. So you have to be in an ICU on a ventilator with a heartbeat and a blood pressure to even be evaluated for donation. So, one of the first myths is that they're not going to take care of me. If they see the donor dot on my driver's license, they're not going to help me. And that's absolutely not true. I can speak from bedside nursing. The first thing that I do when I get you into the ICU, yeah, we rip all your clothes off, right? So yeah, we just throw everything off to the side. My focus is on the patient if I'm in that role. And the wallet goes with the social worker so they can get a hold of the family. Nobody's looking at your driver's license to determine that. And to truly be a donor, we need you to have a blood pressure and heart rate. So we need you to, to be perfusing your organs, honestly. So that was kind of one of the first myths that when I hear that, I cringe because it's just absolutely not true at all whatsoever. So another piece of it, one donor can save up to 8 lives. We can share 8 organs, your heart, your lungs, your liver, kidneys, pancreas, and intestines. The lungs can be split, and kidneys usually go to 2 separate people, but they can go with a liver or a heart or a pancreas. I have been on a case before where we split a liver. It was a middle-aged lady. We were able to split her liver and I shared it with 2 babies. So that was a really special case. That was exciting for me. Um, Along with that, one donor can also help up to over 75 people through tissue donation. So you can share your heart valves, vessels, bones, tendons, skin, and eyes. And truly, I mean, the gift of tissue donation, it just helps the quality of life, which is immeasurable as well, right? Like, so many people just, who maybe are at home because they can't walk good and can get a piece of tendon and then they can get back out there and work again and are so thankful for that gift. So just a little bit kind of background about donation. Um, Next, I'll kind of talk about like what we do, what my team does as an organ donation specialist, which is truly probably one of the most amazing jobs. That when people ask you like, oh, what do you do for a living? It's always like, it's kind of a loaded question. I always say background, I'm a nurse, but our job is multiple layers of critical thinking and soft skills kind of coming together in one. It's such a unique job. So like I had said, the ICU nurse will call and she'll give um, that referral, that initial referral on a patient. So, maybe the physician says that this is a non-survivable head injury. It's not looking good. We're going to start brain death testing. So we'll get a page. And the first piece of it to me, aside from talking with families, is probably the most important piece of a case. We call it establishing suitability, but that's really deciding, is this patient even a candidate for donation? I would never want to talk to a family and offer organ donation to a family if that patient's not truly a candidate. So the coordinators are trained to go through the chart. I like a little private investigator. They truly go through the chart, every single encounter, every note, every CT scan, all of the labs, all of their past medical history, their full current admission course, and we're looking at everything. So it's a very thought out process to determine if somebody is a candidate. To approach for donation, someone just needs to be eligible for at least one organ. Um, and there is 2 different, I won't go too deep into it because it gets kind of involved, but there's 2 different pathways to organ donation. Susan, you talked about Laura, she was declared brain dead. So that's one pathway. The other pathway would be something called donation after cardiac death. So kind of evaluating both to see if they're a candidate. Donation after cardiac death would be then where the patient still has some brain function, but the family's decided that they would like to go comfort care. So that would be then a trigger for us to evaluate the chart and decide. So like I said, that's to me, one of the most important pieces is really determining, it's a very clinical piece of it, but should we be talking with this family? Should we be having that conversation? And if so, what organs would we be approaching for? So I can make sure to give them accurate information. Um, any questions about that at all? No. Okay. With that, the two myths that I kind of have into that one is I often hear is I'm too old to be a donor. Um, nobody would want my organs. I'm too old. That's just not true either. The oldest I looked it up in the nation was a 93-year-old who was an organ donor. The oldest that I've cared for personally, I believe she was 83, and she was beautiful, absolutely beautiful. And so really, it is truly a case by case. Every single referral that we received, we log in and we look and see, is this person a candidate based off of their labs, based off their past medical history, based off their scans, and really evaluate it each case. The other one is I'm too sick to be a donor. That again is not true. We do not have any auto rule outs. Nothing, I mean, I'll say COVID at this time, but I truly think that's going to be changing in the very near future. But aside from that, no auto rule outs at all. Even cancer, like you said, Laura was able to share her organs and she had cancer. If it's a brain tumor or if it's skin cancer, that doesn't rule you out. When I had first started, HIV used to rule some patients out. With the HOPE Act now, we were able to share HIV positive organs with HIV positive recipients. So they're really, people will say like, oh, I'm on hypertension medication and I have diabetes. That's okay. I mean, honestly, we're looking at the function of your organs. And so maybe your pancreas can't go because you have diabetes, but your liver might look okay. So, just really, it's a very, very thoughtful process that we go through to determine that. So the next piece is approaching families. Like you said, Emily, who was the approacher for Susan and Ron, she taught me how to approach, and it's a very soft set of skills that someone has to learn to be able to walk into a room and have this insanely difficult conversation on the worst day of someone's life, talking about something so sensitive after receiving this devastating news. And so being able to do that and do it with dignity and respect to them is of utmost importance when any of us walk into the room. It truly is. So I think about all the families. I was telling Susan, I'm like, I don't know how many families I've approached over the years. I'm not certain, but in 8 years, it has to be quite a bit. And my intentions every time I go in is, and I have a connection with donation. I don't talk about it often, but my husband had a little boy who was a donor. And so I know in my heart that the good that can come from saying yes to donation. And I know all the good that I hear Susan's story and I hear all of the families that I work with. And at the time, I always talk to the coordinators. They're in families are in this little grief bubble and they can't see anything. They can't hear anything else. It's just this cloud of hard, just difficult everything. And so if we can go in there and first and foremost, offer our condolences. And Susan, you had said that Emily was the first person. I think of that every single time I offer condolences to families now, because the physician was in there and told them this news, and then I come walking in after. It's the first time that they're hearing it, and that was very profound to me to keep that in the forefront of my mind, and just to be sensitive to that, and then to help families hopefully see the beautiful legacy that can come from donation. I mean, obviously, we all know that you can help save a life. That's the obvious. But all of the other pieces that are going to come along with that is so important. So trying to pull them out of their little grief bubble and just see all of the good that can come is my biggest intention. My biggest goal is to help them see forward a little bit into that. So when I approach families, like I said, I approach them with my whole heart, and I do it with true intentions of knowing that. With that being said, though, each family that we approach looks so different. They, one family might be angry and mad. There's so many different scenarios how things can play out. So some families are, yelling and screaming. I think about a mom that I approached, and she just yelled at me. I know, how could you come in here and you're going to ask me this? And she's just screaming in my face. And I just sat there with her. And then all of a sudden she got through that anger, and then she just started to cry. And then she like talked herself through it, but I was just there with her to listen and to hear. And she just sobbed and sobbed and sobbed. And then it came to, I know this is the right thing to do. I know I have to do this.
Like
And
posting this big thing
if you could,
and she's like a special guest.
mute your,
So she like
1 second.
Kara, if you could mute your microphone. Okay, where was I at? So I was just saying, every family's a little bit different. Some families, and this might sound bizarre as well, is that some families might be.
Asked it. Sorry, no, unmute.
All right, we're good.
Sorry about that.
That's okay. Okay, I was saying just how different families look. Families, some can be angry, some can be mad, some might even be relieved if someone was chronically sick for such a long time, and that to know that they're finally at peace, and they might be somewhat happy. Some families are, how they handle grief is they might be laughing and giggling, and I have like a really good upbeat conversation. Sometimes there's just the anger, the mad, the grief, the sad, the shock. So it's just a huge array of families. And when I walk in, wiping that slate clean and going in with no judgment, no anything. It might be a drug overdose. It might be, somebody who was doing something illegal that got hurt. I don't care what the situation is. I'm here to support you, period. So that's all it comes down to.
Kenna, you're basically saying that each situation is different, just like each grief journey is different.
Yeah, absolutely.
Same way, I love how you say you wipe the slate clean.
Every single time.
Assume anything.
Yep. So, and you never know what someone else's experience with donation is as well. So sometimes I might get report from a nurse and be like, oh, this family's pretty tough. I don't think that they're going to want this. I walk in and talk about donation, and it's, oh, my aunt received a liver. And then it's like, oh, okay. And then it's the most positive, conversation that I just didn't expect. So really going in with an open heart and a clean slate every single time is so important. Just wanted to talk to you about, we do offer memory making, which to me is really important. I know Children's does a fantastic job, so I'm sure they did a lot of memory making. For some families, that's really important and it's nice. So we do handprints, we do heartbeats in a tube, we give a shawl. So we do offer that. And then the biggest thing is that if a family says no, I'm okay with it. I'm okay with the no. I just want to have that conversation. I want to be able to support you. I want to be able to educate you. I want you to hear me, and I want to know what you're saying no. I want to know that you know what you're saying no to. And donation isn't right for every family, and I respect that, but just listen to me and hear me out. I always joke around that I've gotten some really, really good no's where I think I ended up being invited to like Thanksgiving, like as a joke, but like just having that bond with families that you can create really, really fast, where I had a conversation with my mom and she said, no, she didn't want it. But then I can plant seeds for later on. I can give them information, and for that family then to go back and talk with their loved ones about it, and that they had a positive experience with Versiti or with organ donation. So if it comes back around next time, they'd be interested, in hearing about it again. And maybe they would make a different choice for the next family or for themselves. So after talking with the family, once we get consent, again, very clinical piece then, which is why I like my job. It's a very stark dynamic. We go into donor management. So doing everything that we need to do to gather information to make sure that the gifts are safe for transplant. So I always call organs gifts because they're the biggest gift that you can give somebody. And just anytime I talk about donation, just different words that I can use to kind of soften the language of it. So it's not so stark and not so scary, but so we go through and we send out lab work to make sure that all the gifts are safe. We look at the organ function, take picture of the heart, take picture of the lungs to make sure that we can maximize the organ function for transplant. People are often curious about what we call allocation. Allocation is where we figure out where the organs are going to go. So, during our donor management, we're getting all this information in, all this lab work, echo, bronch. We enter it all into a system. It's called DonorNet. UNOS is the big governing agency over organ donation. So they get all of the recipient information in and then all of the donor information. And essentially a list is generated. So for each organ, we generate a list, a separate list. The lists are formulated by the sickest person closest to us. And then I start making phone calls. Start at the top of the list and I call, it's either a coordinator on the recipient side or a surgeon that I talk to. They're able to log in as well and look through all of that information and determine if that's the best match for their recipient. And so I always say it's the stars aligning, to really find that perfect match based on ABO and tissue typing and size. Everything has to line up perfectly. And so
that's where it felt like in our story, everything lined up in the stars because Trish ended up not even going on the transplant waiting list until Friday, February 20th, where they agreed to even put her on the waiting list. And she ended up being #1 in the entire country needing a liver.
Yep.
So just the fact that it went so quickly out to her is pretty miraculous.
There's so much that goes into it, and to find that perfect match it's exciting as a coordinator to, when you get the call and it's like, okay, we're going to accept the heart, and then you get the next call, okay, we're going to set the liver, accept the liver. It's exciting. It's like the part of the okay, like I'm doing it. The new coordinators, they always get excited the first time they place organs. It's like, yeah, I know what's going. So once we have each organ placed, then we set a time to go to the operating room. So honestly, setting an operating room time, it's a hectic time. It's high anxiety. To me, it can be a little overwhelming. It's like arranging a circus almost. There's just so many people that have to come together at the exact time. The hospital staff, the family, the surgeons, our OPO staff. So getting everybody lined up. I remember learning on orientation, like, okay, now you have to call for the tail number of the flight coming in. And I was like, what? And so people have to get there. We have to arrange for transportation to get the surgeons, and everybody then comes to the donor hospital to make all of that happen. Something that I really enjoy lately, which is newer with Facebook and all technology, is the honor walk. So I'm sure some of you have seen on Grey's Anatomy and Facebook, the honor walks that have really come together, and they are incredible, so special. The hospitals will arrange for that to happen, and that's where they'll do like an email out or a page out to the hospital staff, and then the family's welcome to join, obviously, and they line the hallways. And so it's truly an overwhelming experience to be there with this family, again, still in their grief bubble, but walking their loved one to the OR is just really something special to be a part of. And then I safely get them to the operating room and hand them off to our recovery staff and the surgeons. And they go for the recovery portion of it. So that's a long story short, that's my job.
Did COVID affect the donor situation?
Yes. Initially, we had to really switch up a lot of our clinical practice. We essentially did as much as we possibly could remotely, which is really, really hard to do. Our hospital partners, though, really kicked in, and it's just, I mean, we got cell phones to give the nurse directly. So we have to obviously screen every donor for COVID. You cannot be actively positive with COVID for us to move forward. They now changed it to where you have to, you can have had COVID in the past, you just have to be at least 8 days out with a negative. So, but yeah, we had to change our practice up a bit. A lot more approaching families over Zoom, over the phone, which is so hard to connect that way. You know, I'm an in-person kind of, I want to give you a hug kind of thing. And so it was really hard for some of us to adjust to that, but we still, even given COVID, had, I think, another record-breaking year for us, which was incredible just to be able to
Wow.
still do what we needed to do as an OPO and to offer donation to every family that, you know, should have that opportunity and to make it happen. So yes, it affected us, but we worked through it. Any other questions?
And what other types of questions do people have? I know for us, I have this ultimate respect for the organ donation specialists because they are going into the rooms at this crazy emotional time. And we had to kind of make this decision. And now looking back, what I wish we had, Laura was only 14 at the time. And so she was a minor. She didn't even have hadn't even been old enough to get her driver's license to make that decision for herself. And even though she was very mature for her age and we'd had all sorts of really, intellectual, ethical conversations about topics, we somehow didn't remember ever talking to her about organ donation. And if we had, it would have been a lot easier for us to have made that decision. So I am a big believer in just sharing your wishes with family members. I mean, it's important to register at the DMV and all the legal stuff, but to share the wishes just verbally in conversations and start that conversation going in when there's not a tragedy happening.
Right.
Because I think it makes it easier for the families as well as for Kenna.
Right. It's always hard to approach a family for what we call a record of gifts. So somebody who's made it known that they want to be a donor, and to walk into the room and to tell families, and when they don't know about it and they don't, oh, she wouldn't have done that, she wouldn't have wanted that. And it's a legal binding document. So, and I don't like to use those words, and I really try to avoid them whenever possible. But you know, this is what I know that person wanted. They put it in writing. So I always encourage people, tell your families what you want, talk about it, have that conversation back and forth. It's not, people don't want to talk about it, but it's so important to have those crucial conversations with your loved ones so they know. So, at that time, one, they don't have to make a decision because you've already made it for them. And two, they are aware, they know, and it's not me coming in and surprising them because, unfortunately, I have had people get pretty angry and pretty upset with you. And my biggest thing is to educate them, to help them understand the importance of it and the why, and to just truly advocate then for the donor and what I know they want. So yes, talk to your families.
Can I ask you to, Kate, I see Kate wants to ask a question.
Yeah.
Yes, thank you. Quick question. This is so interesting. I really appreciate the content. I have a friend who lost his son last year, and I was sharing Susan and Ron's story, and he had no idea that there could be a connection like the Millers have with Trish. And so I wondered what I could advise him in terms of the process of connecting with potentially, I think it would have to be maybe you first, Kenna. I'm not sure. What should I tell him? His son did die in this area. So I'm sure, Wisconsin or your network was involved at first.
So for when we do have an organ donor, the family is enrolled in an 18-month aftercare program. So we have a wonderful coordinator, Katie. She's actually on the call. So she sends out letters and she follows up with families. She invites families to different donor memorials and donor celebrations to honor all of our donors. So we really take our donor families, I would say, very seriously, and we keep them close. They get mailings out. I think it's about every 3 months. They'll get mailings out. Normally, I think around 6 to 9 months, they'll get a letter, and it includes information on how to reach out to the recipients. So letters have to come from the donor family to Versiti. We screen them, make sure that they're appropriate, nothing weird or anything. And then we would then forward it out to the transplant side to get to that recipient. If the recipient were to write back, it has to again go through us. And then after a certain amount of time, we want to make sure that the recipients first physically heal up, right? You want to make sure that they get through the transplant okay and get healed. And then they have a lot of mental, to kind of wrap their brain around, to accept the fact that someone had to pass and someone had to die, to allow them to be here. So they sometimes take some time to kind of work through that. So if both parties agree, we have in the past facilitated recipients meeting donor families. So I've been a part of them and they're really special. So I would suggest if you were to have him reach out to us here at Versiti, Katie, her name's Katie Bannock, she would be able to kind of help him get that information to be able to reach out then to the recipients.
Does that answer your question, Kate?
Yes, thank you so much.
Yeah.
Great. Well, and in our case, what ended up happening is about 3 months after Laura had died, we had heard that it was a very special story, that her liver had been transplanted into Trish in upstate New York, but we didn't know much more than that. They couldn't tell us much more than that. And then 3 months later, we received this letter, or like a letter that had lots of blackout pieces wherever Trish had written her name or her address or anything identifying. And so what we could do then is we could write back with our own information and pictures, and it would have to go through the Wisconsin Donor Network and then the New York Donor Network. And it took a while for that process to occur, but they did not want us to know each other's identity until like I think it was a year later. And for us, we actually received an email, or we received a white envelope in the mail 18 months to the day that we brought Laura to the hospital. And I remember opening it at the mailbox and finding Trish's address, name, phone number, and immediately like Googling her to see, what she looked like. And actually that night we ended up calling her. So that was a very special call. Any other questions? So one of the things that I like to mention is when we were asked to donate Laura's organs, they basically, there's lots of choices as to what you will agree to donate. It's organs and it's tissue and it's lots of other decisions that really don't want to think about. But one of the questions was whether or not we wanted to donate Laura's eyes. And that was one of the things that in retrospect, I wish I had known more about, because at the time, I think we were so much in a state of shock that I thought it had to be the whole eye, and it just has a lot of emotion. I've learned lately that, the hearts and the eyes are the two organs that really, they're just so very personal. And now I've learned that it's the cornea, it's just the outer layer of the eye that is taken. And so in retrospect, that's something that I wish I had known more about. And so I want to let other people know that as well.
A lot of people also are concerned about, well, I want to have an open casket and, there's going to be nothing left of them, or, and I always, after working closely with the tissue staff, they do such an incredible job at reconstruction and truly maintaining dignity to that person, that you could have an open casket. Nobody would know that you were a donor. For the eyes, like you said, most of the time it's just a very, very thin contact layer, the cornea on the top of your eye. If someone were to need like the whole eye, it is a possibility, but they would put a prosthetic in. So you could have an open casket, and honestly, nobody would know that they were an organ or tissue donor unless families chose to share it. So, just knowing that dignity piece and that respect piece, it's through surgery, through the tissue recovery process, is maintained at the highest level throughout our whole case. I tell families, they're never alone. There's always a coordinator. I go with them into the operating room. I'm there with them the whole entire time. Our coordinators, we're there with them. I truly look at all of our donor families as if it was my own, and really being what we say in the OPO world, being a good steward of the gift, doing the best that we can to really make sure that we maximize the gift the best that we can, and that we respect and take care of the donor and their family as much as we can. So,
Kenna, one of the things that I keep thinking about is how when we would tell friends and family about Laura's donation and gift of life, how people would all just get goosebumps. And it really allowed us to be able to talk about Laura way past the time when we felt like people just didn't want to hear us talking, and we could then bring up Laura's name as, look at what a wonderful gift she gave, and we
it's
want
the
you to know more
legacy
about
piece.
Trish. And it does feel as though she's still living in Trish. And one of the we're in FaceTime friends with Trish and her whole family, and she has 4 brothers and sisters, and 90 and 95-year-old parents. And whenever I see their entire family together on a Facebook photo, it just makes me realize how their whole family, we saved their entire family from the same type of tragedy that we went through, and that it would have had ripple effects throughout their entire family as well. And it just, I mean, we met the father, this is maybe about 7 years ago. We met them up at their cabin. And I remember at the end of the night, the father gave me a hug, and he basically said, "We're eternally grateful." And, it kind of doesn't get more, I don't know, meaningful than that. And it's just amazing how by telling these types of stories, it like creates this network of people that then tell other people, and potentially will help someone make a decision that will help save someone's life.
When I talk with
And
families, I often talk about that legacy piece of it. Like, Laura truly left this incredible, beautiful legacy to remember her by. I mean, you have such a unique, incredible story with Trish being able to meet her family and to see them, but just for families to know that they live on through that amazing legacy, right? And then for some families, maybe their loved one passed away from, like I said, a drug overdose, and it's a way to rewrite that end of the story, so it doesn't just end in that hospital room that day. It carries on, and you can share those good memories then, and how she was truly a hero, and that beautiful way to remember them by. Is
so Kenna, the one thing that we haven't really talked about too much is like live donations. We've talked a lot of and how that comes to pass.
I can say we don't, Versiti doesn't do a lot with live donations. So all of that happens through the transplant centers themselves. So we have 3 transplant centers here in Milwaukee: St. Luke's, Freighter, and Children's. So live donation, it would be like when you're talking, if somebody would want to share a kidney. So someone has to go through quite an extensive evaluation process through one of those transplant centers and deem that they're of good enough health to be able to be a live donor. And then all of that process goes through the transplant centers and I know that there's quite an interesting, like a domino thing where you can, maybe if you don't match up exactly with your loved one, you could share to somebody else, who then someone could share back to them. So
You taught me something new. You taught me something new today. I didn't realize that.
Yeah, so we don't do any of the live donation piece of it, but if you were to call Freighter, if you were interested, I know I see billboards on the highway for people who need, you know, a kidney. You could absolutely call and they would be able to help kind of get you into that process, work you up. I know it's, you know, it's a surgery that you got to stay for a couple days. And then a fun fact for that, I don't know, but if you're interested, if you do ever share an organ for a live donation, and then if you were ever in need of an organ, you get bumped up higher on the list because, I mean, you deserve it, right? So every once in a while I'll run a list and you can see somebody who had shared a kidney who maybe then now needs one, they get bumped up on the list.
Kenna, the question that hasn't been asked is how does faith and or how does religions view organ donation?
You know, we get a lot of education, a lot of ongoing education, and we do hear that. We do hear that often, you know, oh, my religion's against that. The biggest thing I can say is there's no religion that outwardly opposes organ donation. It's a very personal choice, but there's no true religion that says no to donation. I know for sure the Pope, I'm Catholic, has, you know, advocated for it, and like you said, it's the highest mitzvah. So we do have our CODAR. What we have here at Versiti is called the CODAR program, where we go out to different churches and different religious affiliations, and we provide education kind of similar to this, to at least educate people on that and get people talking about it within their own faith community. So.
Anne, did you have a question?
I do. First of all, I'm sorry I was late. I thought this started at 12:30, but I'm happy to be here. The reason, well, I have a question about marketing, because I came into this, I'll just say, arena of transplants. I'm a singer-songwriter, and I was asked to write a theme song for the Transplant Games of America several years ago. And I did that. And so by doing that, I was invited to perform, you know, downtown Cleveland. And I got to hear all these stories. Like a lovely man read a poem that his wife wrote because she was a heart donor. Or he wrote it and he was like, take my heart, take my lungs, take it. It was just incredible. It was absolutely incredible. And to me, the most powerful things are stories like Susan, your book, you know, and the stories that you hear just people tell, and even the story that I just heard here, you know, about Trish, that are most compelling. And I found at the transplant games when I was there that they were sort of preaching to the choir, and there were many people that, you know, would say, well, what are you doing? Where are you performing? I say the transplant games. Well, what are those? So to me, I wonder about where and if there is any sort of major effort to inform people and share these stories more broadly, because there seems to be a lack, even in this conversation, there's a lack of understanding about what would happen with someone's eye, or if they wanted to have an open casket. This is information that people outside the fold of transplants, you know, need to know, and they need to be inspired by these wonderful, like these stories that are heartbreaking, but they're emotional, and they are the things that move people, in my estimation, to donation. But I saw in that Transplant Games of America a bit of a fall off where marketing is concerned. It looked beautiful. It was a wonderful event. They had a theme song, but as I saw it, people need to hear the theme song. People need to hear these stories. And I just wonder if you could speak to that, if there's some kind of effort where we could somehow reach the broader public.
I mean, I have to personally interject. I would never, ever become an organ, put that on my license if it wasn't for my connection to Susan and her personal connection. Never. Never in my while, I would just never have done that. And I told my husband, I said, I'm now going to be an organ donor if I were to die. Just want to let you know. And I'm like sending a text to my family, to my kids, just so you know. It just would never have happened. So that's just one little branch from you, Susan. So I think that's what it has to be a personal, somehow, I don't know.
But it can.
But your
be-
point is that's exactly what it is.
It has to become personal through a story. Because I might never meet someone like you met Susan, right? You knew Susan, and so you knew. But I can get to know someone from a video or a commercial or a song or that tells me a story, and then I can be empathetic enough that I would say.
I mean,
yes.
Forgive me, Susan. It's in your book, right? So it's in your book.
The story.
The
for sure.
story. So
And it's a donor family story, which aren't told as many times potentially as recipient stories. But it's funny because just on the Today Show this morning, there was a very heartwarming story about the Lane Thomas Foundation, which was started because of the 2-year-old who was unfortunately killed by an alligator at Disney World. I don't know if you remember.
that story that haunted me for weeks.
Like 6 years ago.
That was the most horrible story.
So they basically turned their, pain into purpose by trying to educate about pediatric recipients. And I know Donate
Okay.
Life, what Donate Life is like the marketing organization within the United States that is tasked with getting some of these stories out. But I totally hear what you're saying. Kenna, what do you think?
It goes back to, for me, the CODAR program that we have, and just moving the dial a little bit. It's hard to just, and so our group here, the CODAR, which is like the religious piece of it, we went out to our community here in Milwaukee and we said, how would you guys like to receive this information and where would you want to get it? And a majority of them said, through our church, through our religion. That's when we are kind of opened up to kind of think like that or talk like that. So that's how we started that program, where we go out to these different churches. We have lunch and learns where we have a big group of people and we bring in recipients, we bring in donor families, we share their testimonies, and then I've done many of them, a group of whoever is off call that day will go and just share facts about donation just like this. And so that's what we're doing here in Milwaukee. But I completely agree. It feels like you're standing on a mountain yelling about this. And I was so excited, Susan, when I saw your book and I read it, because it shares that that powerful message out to the world that just doesn't get enough credit. That, we need people to hear those stories, to learn and to read and to just actually feel it and get those goosebumps and be like, wow, that can actually happen. So we do what we can here. I educate students. We go to tons of colleges around here. I'm going to be doing a high school presentation. We do like through the DMV, the Learning to Drive program, whatever. So we go and we have conversations with kids, when they're getting their permits. So just try to get that message out, to think about it, to talk about it.
Do you know how many people in the United States are actually organ donors on their licenses?
I do know that 90% of the people, when asked, agree that donation is something that's good, but only 60% of the United States is actually signed up to be a donor, which is a disconnect, So.
And the other, you gave me a great segue to just explain how meaningful that one decision that we made that day in February has been in our family. It was this like little kernel of potential hope. And because Sarah, my daughter, who was 12 at the time and was so passionate about encouraging us to donate, in high school, when a couple of years later, she started educating in driver's ed classes in the Milwaukee public school system. She did a couple of those. And she used a video that we created, that Versiti helped us create, called Laura's Gift of Life, which is like a 5-minute video that I think my husband put the link in the chat box. But I would really suggest that you watch that and feel free to share it with anyone if you're talking about this presentation. And where was I going with this? So Sarah in college could not find an organ donation advocacy club to join, and so she started one herself, and it's called SODA, Student Organ Donation Advocates, and she has now, it's a nonprofit, and she has 30 high school and college campuses that have clubs that educate students about organ donation, because at that age, you know, people are impressionable and are making really difficult decisions, and so through that, I mean, it just keeps becoming this big domino effect or ripples.
Susan, it's Ron on that. I mean, I think what's interesting to us, we really were not prepared for the decision. And it was not something we had talked about, as Susan said. And we really didn't think about it then for many months. It was not once we made the decision, we didn't think about it until we got that letter. It was like Susan said, it was a kernel that was planted. And it's just proved to be so healing and helpful. It was the seed that was planted that we didn't think would sprout, and it's changed my life, Susan's life, Sarah and Rachel's lives, and become a way to rewrite history, a way to do good. And that wasn't why we did it. And that wasn't anything for several months. And it's just blossomed. And 12 years later, look at the momentum. It's, you know, all of us have a passion for organ donation, and that wasn't why we did it, and it was just that seed that Susan said.
Question?
Yeah, I'm just going to make a statement. I guess I've been fortunate because both through my church, through my children's high school, and through my own charitable organization, I learned about organ donation. We always had blood drives through our church. My club that I belonged to had us all, and I had done this before they actually did it, but they tested us for bone marrow donations. And so I signed up right away to be an organ donor. And eventually all 4 of our children signed to be organ donors, and Versiti or the blood center knew that. So as we were leaving the emergency room and we were going up to ICU, our nurse, Laura Lynch, or our coordinator, Laura Lynch, came along, and she said, I know that Jeffrey had signed himself up to be an organ donor. He started blood donations when he was 16 through high school. And then I don't know exactly when he signed up to be an organ donor, but I do know that every time he used his credit card, they had to see his license, and the orange dot was on there. So I knew, even when we were in the emergency room, this is something that Jeffrey wanted. And then some of the other decisions, the brothers and sisters said, oh yeah, absolutely. We've talked about that. So it was, and I can't say enough about the people that are up on ICU and how kind, this was at St. Luke's, and how kind and considerate they were to Jeffrey. Always treated him respectfully. He was brain dead within 2 hours after we were notified by his work that he was on his way. And we actually did get to go and see him personally. We got there at the same time as the paramedics. So it was, but it is, you referred to it earlier, Susan, as the fog. Because you get through all of this, and then the next few weeks, you're sort of like, did I really do that? Or
Exactly.
those type of things. And it's confusing. It's confusing. And
Thank you, Maureen.
I was fortunate. Yeah.
No, I appreciate you telling your story, and I just wanted to for kind of time's sake and all that, I wanted to give Kenna a chance to kind of wrap up a little bit and maybe maybe leave us with a couple of takeaways from maybe your personal experience with your job, or what you want to leave people with as kind of takeaways.
Ah, um, you know, I really do think I have the most incredible job ever. I really do. It's why I've been here for so long. The average lifespan of an ODS is like 2 or 3 years is what they say, because it is so intense of a job. But being, resilient and self-care and doing those pieces so I can continue to help families, and I can continue to not only help that family, but then the families that they're going to affect is the most, you know, important piece of being an ODS, is having that resiliency piece of it. Um, when I was talking with my friend this morning, it was, you're at home and you're crabby about something, you're angry about something, and then I come into the office or I come into the ICU and I talk to a family and it sets you straight. All of those things are, that's not important. Being here with your family, being here and putting your priorities in check, so I can go home at night and appreciate what I have at home and appreciate my family is my biggest personal takeaway, so I can continue to keep going and keep giving back. For my message out there, talk to your families about organ donation. Tell them that you want to be a donor. Obviously, signing up through the DMV, there it is in black and white, but having those conversations makes my job a little bit easier, obviously, but it's just so impactful and so important to have those conversations. So there's no question. It's just, I know that that's what she wanted, and this is what we're going to do, and this is right for us right now. So
That's perfect.
yeah.
That's perfect. Thank you, Kenna. I so appreciate you, and I know Eva is on the line and on the call, and so is Katie and a couple other people from Versiti, and I really appreciate everything you do every single day. And I also wanted to just share in the chat box, there were a couple of different things. One is this short YouTube video clip of our family story that was made 5 or 6 years ago. It's called Laura's Gift of Life. There's also a couple people mentioned that I did write a book. I published it about 2 years ago. It's called Permission to Thrive: My Journey from Grief to Growth. And I think that link is also up there, and I'll probably send out an email following this call. And let's see. And also, I mentioned that I had been doing these Zoom calls once a month, and in May, maybe write a little save the date for yourself. There's on May 20th, Thursday, May 20th at noon, I'm going to be hosting another author. Her name is Kelsey Crow, and I'm very excited about this. She wrote a book called There's No Good Card for This: What to Say and Do When Life is Scary, Awful, and Unfair to the People You Love. It's a mouthful of a title, but it's one of the more empathetic books that I've read, and a very good kind of a rubric for how do you handle dealing with people in your lives that are facing challenges. And we know that we will all face challenges, and our friends and family will all face challenges. And so I think that's going to be a great discussion, because it's a topic that we just don't often talk about. And especially with COVID having happened and people having died before COVID and not being able to grieve properly, or people dying within COVID, there's just a lot more grief and death and loss out there, and we need to address it. So in any way that I can help, and I'm happy to do that. So if there's no other questions, I think we'll sort of wrap up, and please feel free to keep in touch in whatever way possible. And if you have questions, I can help forward them to Kenna. And I'll probably also send out an email that has all of those links and contact information. I really appreciate everyone showing up today.
Thank you.
Thank you so much.
You're welcome.
Thank you.
Have a good rest of the day.
Thank you.
Thank you.